Hello and welcome to Senior Moments. This is a program about seniors with programs that would be interesting to them about health, wealth, and actually happiness. And that's our goal, is to bring interesting people from the outside in here and just talk to them and find out what we can do and how we can just be better at getting as we age and getting older. Today, I have a really interesting guest. Our guest is Heather Carroll. She's from the Alzheimer's organization in New Hampshire. She covers Massachusetts and New Hampshire, so she's got a lot of information. And it's really a pleasure to bring her here today, and I'm glad she came down and took the trip so early in the morning. Hi, Heather. Thanks for coming.
Thank you for having me.
Alzheimer's organization. What is it?
The Alzheimer's Association is a nonprofit organization that works with families, caregivers, professionals, and people with Alzheimer's disease and related dementias, and helps them get educated, helps them learn about the disease process, and we do fundraising events, and we do research and public policy.
Now, I think what I know, my confusion was a few years ago before I started to understand Alzheimer's a little better. Alzheimer's is a category under dementia.
Correct.
And what would be kind of a definition of Alzheimer's or dementia? How would you define it so people could get a handle on it?
I'm really glad you asked that question because we get that question all the time. Dementia is sort of the umbrella term for a lot of different forms of dementia, which Alzheimer's is one of those forms and the most common.
Okay, so then Alzheimer's, are there some others? What would be the others that would be?
There are. There is frontal temporal lobe dementia, which we've been hearing a lot about with the football players and the NFL.
So concussion related?
Concussion related. There is vascular dementia, which sometimes happens due to heart issues or post-stroke. There is, we were talking about Lewy bodies dementia earlier, and Pick's disease. So all of those are forms of dementia and separate from Alzheimer's disease, but affect different parts of the brain.
And Alzheimer's seems to be the category that is the largest category?
Correct, correct.
How many, do we have a percentage-wise?
65% are affected with the dementia. It's usually an Alzheimer's form.
Okay, and like, let's say as we get into the population, how does, I'm sure everybody would be, who's watching this saying, is it me? How do you, I guess the statistics of how many people get Alzheimer's?
It's tricky because we're starting to see diagnosis happening a lot earlier due to education. But we see age, unfortunately, is the biggest contributing factor. So they say usually when we look at the death rates of this disease process, it's usually 1 in 3 seniors that develop Alzheimer's disease.
So 1 in 3, and now, if I remember correctly, because we'll talk a little later, but I did go on your site and I took some educational programs on there that were actually free.
Correct.
And I learned that as you get up into the 80s, is that when you become the 1 in 3?
Yes, yes. You're almost over 65 increases, and then it almost doubles over 85. So unfortunately, if we could figure out how to not age anymore, that would be a key factor.
That would be the solution.
That would be the solution.
All right. But now here's something. When I first saw that statistic, I'm going, wow, 1 in 3. And then I rethought it. I said, all right, 33% have it, but 66% don't.
Correct.
So,
but we have a bigger population.
It's certainly something we want to be aware of.
Yes, we have a bigger population. We're also living a lot longer.
True.
So I think that's what has kind of thrown a lot of the statistics into sort of heavier territory when we look at them.
Okay. See, one of my pet peeves, and I've worked on this for the past 5 years, is smoking and smoke-free communities. And the one thing I did hear or read is that smoking actually is the one thing they can say does contribute to Alzheimer's. Is that a fact, or is that something I just made up in my head because I want to?
Unfortunately, I don't think we have any direct research-based that correlates that, but there is correlation between healthy heart, healthy brain. So we all know smoking is not good for your health, overall health. So if your body is challenged by having to fight off a secondary disease process like a lung cancer or coronary issues due to smoking, that kind of sets you back a little bit if you develop Alzheimer's disease. So now you have two sort of almost comorbidities happening.
Okay, so that I mean, overall health is the ideal process.
Absolutely.
So essentially, we know right now about Alzheimer's, we don't know what causes it.
We do not.
And that's the mysterious and probably bothersome part of the whole thing, because somebody could be living a pretty healthy life and all of a sudden, I mean, is there any kind of category that people fall into, or is it just you know, let's say that people who work the third shift, you know, frequently, you know, is there any statistics like that that bops people in this?
Unfortunately, no.
So there's really no way.
Aging is one of those factors.
Okay.
They have, through research, they have figured out the biomarkers. So they can look for that, and they can look for gene links with families that have developed Alzheimer's disease throughout the family. But the tricky part of that is you can have all the predetermination to have the disease process and never develop it because of what your lifestyle was.
Yeah, so then lifestyle is important. Now, one of the things we do normally, and I don't have my pig today, but I'll have it next show. We set a pig at 15 minutes, and then when the show is in 15 minutes, we stand up and move around, because we talk about sitting is the new smoking. So people who now, as we age, and I'm guilty of this a lot, I'll find myself sitting watching TV for 3 hours in a row. And at the end of it, I go, what, am I sick? So now what I do is if I'm watching TV, anytime there's an ad, I'll get up and move around and do some kind of exercise. So I try to accumulate so many minutes of exercise while I'm watching the program, and then I justify it.
That's a great idea. Sedentary lifestyle is a contributor to a lot of disease processes. And when we talk about having a healthy lifestyle, exercise is one of those components of it, and getting up, moving, whether it's walking, just moving yourself around, changing location can do wonderful things as well. So we heavily encourage at least 30 minutes of exercise a day.
Now, you do some things, you told me before the show that you're doing some things in Andover?
Correct. There's our biggest fundraising event, which happens in the fall. I believe it's in September. In Andover, we have the Walk to End Alzheimer's, which brings a lot of people together to help rally for the cause. And it's a great event.
And that's in September?
Correct.
Now, if somebody wanted to find, well, I think first of all, we want to find out about your site, because you folks got a great site. I mean, whoever put that together put a lot of time and a lot of energy in it. That's a great site. Easy to navigate, I find.
Yes.
Now, I did take some educational programs on there. So if somebody wanted to go to your site, could you kind of give them an idea of what they would, what they would find and some of the things that would be helpful to them?
Well, we certainly pride ourselves on being the brains behind saving yours. And so our website is very user-friendly. All of our services to families and caregivers are free. So the website is just chock full of excellent information. It can get you connected to education programs that are happening in the community. It can get you connected to professional programs if you are a professional caregiver, support groups, different ways to engage, which one of those is the walk. You can form a walk team and rally your social circle and your neighborhood into rallying to fight this disease process. And there's public policy piece where we are working on legislation on the federal and state level for Alzheimer's patients and caregivers. We also have Trial Match, which you can look at different forms of getting involved in the research studies that are going on in our area.
Now, you just said something interesting earlier. We were talking about this, and you don't have to have dementia to be in the studies, right? They need a wide variety of people?
Correct. There's a lot of different ways we're looking at combating this disease, because unfortunately, the person with Alzheimer's disease, it just doesn't affect them. It affects the entire family. So we have studies on caregiver stress. We have healthy brain studies, because we need control groups to look at that. We do different kinds of trials on people with certain types of dementia, whether they're amyloid plaque-based or they're tau plaque-based studies, and you do not have, there's no age group. I think it's over 18, because we want to look at the whole brain from start to finish. Wow. So there's a lot of different ways to get involved, and it doesn't necessarily mean going to the doctor's office or going to a research lab to be poked and prodded. There are certain studies that are online studies. They just want to talk about caregiving. They want to talk about what it's like to experience this disease process, maybe at a younger age when we have folks that are being diagnosed at 42, 43. So there's a lot of different ways to get involved. And we need the numbers. We need lots of numbers so that we can narrow it down to move the studies forward.
So all someone would have to do is just kind of check into your thing and you could volunteer.
Correct. There's a trial
Organizers?
match section that you fill out that puts you into a database that looks at your statistics and matches you with trials in the area.
I think that's great. That's a great opportunity, for especially, because I would say that the people who right now are 30 years old or 40 years old are the people that really should start looking at their behaviors.
Absolutely.
You know, what they're eating, what they're drinking, what they're smoking.
Correct.
And
I tell the young ones, what you put into your body, you will pay for later.
Yeah,
So everything in moderation.
Well, I know myself, when I was in my 30s and down, I was indestructible. And so you do more of everything.
Absolutely.
And then, then you realize, you look back and say, wow, that's affecting my health.
One of the questions we talk to a lot of people about is we ask if they've ever had a head injury before, and that can be anything from playing football in the 40s in college where the helmets were not quite as intact as they were, to possibly being a veteran in one of the wars where it could have been a percussion injury, right up to just a motor vehicle accident, things like that. So protecting your head is a very big message that we like to give people.
So I think the other side of this is that I know that's kind of the unspoken part, are the families of people. It's got to be difficult. And how do they, you said you do some education with them, teaching them to cope with somebody?
Correct.
Because the process is, I think the more you learn, the better your education is. Life is going to be much easier, I would assume.
Absolutely. I think empowering yourself with education is a very good first step. It's a very scary disease process that we do not have a cure for. So when you're tackling something that large, going it alone is really not an option. It can be very isolating. And so we want to make sure that families have the caregiver supports in place and have a care team to help manage that person with Alzheimer's disease, because the new reality is that you have to change your way of thinking, and it's now based around the person with dementia, and we all exist in their space. So a lot of adjustment has to happen.
Now, is there room, let's say, is there a need for people in the professional side of this who would be caretakers, or is it pretty much, one thing I read, there's no funding for like a lot of the caretaking process, so the families end up doing it?
This is one of the things that we tackle quite a bit on the legislative side as well as the family caregiver side. The amount of unpaid hours that caregivers have to go through, using up their vacation time, using up some people have to retire early in order to take care of folks that have this disease process, because it's a 24-hour way to take care of them.
You don't think of that.
Yeah, and our professionals, there's not enough of them out there that are correctly trained to handle the gamut of the whole spectrum that could potentially take place. Frontal temporal lobe dementia presents much differently than Alzheimer's disease. So we really have to train our professional caregivers what to expect and to expect the unexpected sometimes. And we want to create an environment, whether it's at the home with the caregiver or in a professional setting, that is the best for the person with dementia.
Yeah, it's complicated, but I'm going to say, like, I was really interested in your site, and I can see that if anybody has any interest in Alzheimer's or has a family member, that site is really worth it. There's so much in there, and I guess you could fool around there for days.
Yeah.
I've taken a couple of those courses, and I even brought to prove it. So I got these little, you don't have to take a real close look at them all, but you get these little printouts to say that you understand the basics, and that's important for me in my age group, and friends of mine, and also what else the 10 signs. What are the 10 signs, if we get time to do them?
Yeah, absolutely. Knowing the 10 signs is a great program that we give out to a lot of general audience spots. It's a very interesting program that we give that kind of delves in a little bit deeper. There's always a memory issue component, but it may be not able to manage tasks, a lot of tasks. We see a lot of people not able to handle their checkbook anymore because there's a lot of working parts with that. People who often start to isolate a little bit because maybe they don't want anyone to know about the disease process. Change in mood and behavior happens a lot with this. It can be a very scary process to go through when you start to forget things. So those are some of those components that we look for. Balance issues often happen because the peripheral vision starts to go. So people lose their spatial sort of identity as to what the depth perception is. So when we're seeing someone with increased falls, we know to look that maybe there's something cognitive going on as well.
But I think there's always the point, and I know I've talked to a lot of people about this, and in some of the programs I do with elderly, we all forget.
Unfortunately, it's a normal part of aging.
Yeah, and
our brain's getting older.
I don't even do it to age, and I just say I have more information in there, so it takes me longer to actually retrieve it. And so that, like, forgetting where your keys are, or forgetting someone's name certainly isn't a sign of Alzheimer's.
No, and I think much to people's relief sometimes. We live very busy lifestyles. We live very stressful lifestyles. So those are all contributing factors to us forgetting in the daily process where our keys are. It astounds me that, salmon can go right back to the place where they were birthed in a river, and I can't find my car at the mall sometimes.
Right, yeah.
People get nervous sometimes, but it's sometimes a good thing to get nervous so that you can get educated and aware of it.
Right.
So if something does change, you'll know that this is not the normal baseline.
Okay, yeah, and I think that's it. And I know I've talked to this in the 50s. As a boy, my family family members in our society would not mention the word cancer. They would not mention it. Like if somebody did whisper that she was diagnosed with the big C, because they were so afraid of it.
Absolutely.
And I almost see, Alzheimer's really has to be brought out and start, we all really have to talk about it because it's obviously, if it's 1 in 3 as we age,
absolutely,
we're going to be affected some way by that.
When I go out and do speaking engagements, I ask who here has either a direct link to this disease process or has been affected by it, and the number of hands is many, many more than I used to see.
Wow.
So this is starting to touch people. It's starting to have direct effects on them. It's certainly, with some of the celebrity champions who have come out, Glenn Campbell, Coach Pat Summitt, and sharing the fact that they're living with Alzheimer's disease has really helped the stigma. Also, education of doctors so that the diagnosis is happening earlier. So, back in the day, if you were in your early 50s and you had memory problems, they didn't even look at Alzheimer's disease as a contributing factor. Yeah. Or there's got to be something else, we just don't know what it is. Right. Now doctors know that that's usually when it starts. So we want to make sure that we're educating physicians. And also people are getting more comfortable because we have to talk about this disease process because we are now in the spot this day and age where Alzheimer's disease is the epidemic of our time.
So if some group or an agency or an organization wanted to have a speaker, they can actually contact you and either you or you can send somebody out to...
We have a whole speakers bureau. We also have a med-sci committee, so we have doctors and physicians and researchers that can come out and give talks. We have education programs. Our clinical staff is amazing, so they're always on hand to give more technical expertise where needed. And we have people who go out and do the basics and answer questions for community groups and civic groups. So we definitely we're on the go a lot. We're getting a lot more coverage. We're seeing it on the news. Regular mainstream media is carrying stories about this disease process. And the level of awareness has certainly been raised all the way across the country, right to Washington, D.C.
No, that's great. Now, the big thing is, how do you afford to do all of this?
We are a nonprofit, but we also, we get grants from certain organizations, but we do a lot of fundraising on our own as well, so that we are actually the #3 contributor to research behind the federal government, and the Chinese government is #2.
And you're 3?
The Alzheimer's Association is #3.
Wow.
So we really put our money where our mouth is to try to find a cure for this disease.
And so through some of the activities, or people could just, I mean, if they want to donate, they can, but all
Correct.
that's on the site.
Yep.
So
Yep.
that, well, you know, I think there's so much more here, and I'm going to follow this, and I'm going to see how, you know, what new is happening in Alzheimer's, and because I think there's so much to go on, and I think we're really going to be surprised in 10 years with all this effort, especially you guys. I'm amazed at how
I've
the
never
work
worked
you
so
do.
hove to be out of a job, and I would love to turn the lights off and go find another career.
Yeah,
but
that is probably.
I'm very
walk away and
passionate
say,
about
yeah.
finding a cure because not only have the families that I work with every day struggle with this disease process, but more often than not, the people with dementia don't want their grandchildren to have to go through the same thing. So
Yeah.
they want a better return for this. So.
And I think that's the big thing on this, and the thing that I took home and that I learned from the education things, that the importance is the early diagnosis, and then, so somebody who's diagnosed with a form of dementia or Alzheimer's can actually be part of the planning process.
Correct.
And I mean, that seems so important, and I mean, the people that I know that have been diagnosed with this, that's the one thing they want to do. At least now
They have control.
they're aware of it, and they
Yes.
can actually be part of the process. That
Yes.
seems to be one of the biggest things. You must see
It's
that
empowering.
all the time.
It's very
Yeah.
empowering. And you know, you want your wishes to be respected, and it is a terminal disease process, and it's a heavy message to receive. So building your care team, being active part of your disease process, we find a lot of families, when they engage in research, when they engage in public policy, it's very empowering in a very powerless disease process. But it certainly is a good thing. And they're tough questions sometimes to have, and it's a tough subject, but we certainly want people to have to be able to relax and their families to be able to enjoy, you know, sort of not be burdened by so much that it's overwhelming. So you know, estate planning and getting your affairs in order is very important.
What is the kind of, from the diagnosis on, I mean, is there a span? I mean, is there a time frame, or is that just?
It's tough because it's a very individual disease process. If you've seen one person with Alzheimer's disease, you've seen one person with Alzheimer's disease. So it affects people differently. The rates sometimes are differently depending on lifestyle. It differs depending on if you're a male or a female. So it's interesting. Also, what type of caregiving and what type of setting you're in can certainly prolong a healthy outcome.
Okay, no, that's really great. Well, Heather, you have filled us with so much information. Now I have to think all this. And
It was a lot, sorry.
No, but I think it's great. I think it's one of the most important things that we can do, and I hope, you know, anybody that's out there watching it will contact Heather and her group, and we will have the website up.
We have the 24-hour helpline as well, which is the 1-800 number, which anybody can call. Professionals
Okay.
can call,
Anytime
caregivers can
there's
call.
anybody who's having a problem.
Absolutely. 2 in the morning, 2 in the afternoon, December,
Wow.
January, whenever they want, they can call us.
Now, is this all out of New Hampshire, or is this a national type of?
From 9 to 5, it is my colleagues answering in Watertown, Mass., which is right in our hub. And then on the off hours, it is answered at our call center in Chicago. But anything related to Massachusetts or New Hampshire comes directly to us. So we do all of the follow-up and the care planning.
Okay, great. Well, Heather, I want to thank you for coming out and
so
spending the
much.
time with us.
Absolutely.
And for folks, I hope that you get that website and take a look at it, because some one of us is going to be affected by it. So we need to know as much as we can and do as much as we can. And I want to thank everybody for coming in, and we'll be back next time. Thank you. Welcome to Senior Moments. I'm your host, Richard Mullen, And I hope we have some interesting information that's going to change your attitudes about health, wealth, and happiness. That's our goal anyhow. Our guest today is Beth Green, and she's from Haverhill and a chiropractor. And she's going to come in and tell us how we can have better spines and be happier and healthier, I believe.
Yes.
Thanks for coming in, Beth.
No problem.
Now, Beth, how long have you been in the business of chiropractic?
Yes, I've been practicing 18 years.
Wow, 18 years? Now, how long, to be a chiropractor, I don't think people realize how much goes into it. A lot of people, oh, chiropractors, you know, there's something like sub-doctors, but how long did you have to actually study and be involved before you actually were licensed to do that?
Yeah, the fastest you can do it in is probably 5.5 years, and that's straight through. So you need to do undergraduate studies that consist of organic chem 1 and 2, chemistry 1 and 2, physics 1 and 2. So you can squish all those in maybe 2.5 years if you wanted to. And then once you take those prerequisites, then chiropractic college is straight through summers 3.5 years. So it's a fairly intensive program. Very often people get a bachelor's degree in biology or zoology and things like that, and then they'll go on, but it's not required for a bachelor's.
So then straight chiropractic school, so you're going 3.5 years straight,
Yes.
and those are all definitely just physical courses on the spine and everything related to it. I mean, of course, that's tons of stuff. When you talk about the spine, it's like,
Yes.
you think, oh, the spine, but you got peripheral and you got central,
Oh, yes.
and
Yeah.
and that affects everything we do. So when you see somebody, I mean, is there a diagnosis type of thing you do? Do you go through a process with somebody when they first walk in your office
Yes.
to find out what's going on with them?
Yes, I do. So, you know, of course, a consultation and a history and what their body's been through, any kind of traumas they've had. And then, of course, doing an examination, which consists of orthopedic tests and neurological tests and chiropractic tests and palpation. A lot of it's palpation and seeing how the spine is moving. And a big part of our assessment is posture, believe it or not, because posture is a great window.
I have to sit up straight now while I'm talking to you.
Yeah, check people in their normal posture. Posture is a great window to the spine. And so postural analysis gives us a window. And then on some people, I will request x-rays on it. Not certainly everybody, depends on their history, their age, and what their body's been through, and their presenting complaints. I will have x-rays done, and that's another analysis as well. So,
Is there a typical complaint? I mean, do you find like one complaint more than another when people come to you? Is it because, I mean, obviously I imagine pain or discomfort draws
Yes.
people. We don't do anything unless there's some kind of
Right.
payoff for us, right?
yes.
So what's the biggest reason people come to a chiropractor?
Well, pain, of course. And I would love to educate the community and my patients. Not everybody comes to me for pain, which is refreshing. Some people come, I just want to be healthier, and I just want to have a better immune system, and I have little babies. Those are not the most common, but once you're educated, like anything else, you'll get that. But pain, probably like low back pain, neck pain, headaches. Those are probably the top 3.
So yeah, lower back pain I understand is probably the most medical complaint. I read that someplace in my research to talk to
Yes,
you.
and I think lost time of work and
Yeah.
things like that. So yes, it's a big problem, certainly.
And it's so, I think the spine and everything that goes with chiropractic, it's so confusing because I mean, it's happened to me a couple of times. When your spine goes, it hurts. I mean, and like I felt at one time, I don't know what it was, but I felt like a puppet on strings, and someone forgot to pick the strings up, and it was just like nothing worked right, and it was
Right.
something in my spine, and you know, I rested. I couldn't do much for about 10 days. Just hung it out, and you know, I'm thinking like, I wonder what I should do about this. And sometimes you feel foolish. I think, I don't know, maybe guys are guys like me, but you feel foolish going in and complaining about, you know, I can't walk, you know, something really serious, right? And someone say, oh, that's nothing, you know, go home and tough it out. But do you get a lot of that? I mean, are guys harder to deal with than women?
Yes, they are. Interesting that you bring that up. Usually guys have to be crawling before they come in. And I think it's just men's nature. They want to be tough, you know, the breadwinner, and they don't want to, you know, be perceived as that. So usually to the point where they just can't work. I mean, if a guy can't go to work, that's a problem. But very often they kind of tough it out and things like that. I like to educate my patients, men and women, that when we're experiencing pain, it's our way of our bodies talking to us, and we should listen. So pain is our body's way of talking to us, and that's when you want to pay attention. So if your body's having pain or some sort of body signal, that's the time to either go to someone or perhaps rest, take the time off work and really listen to the body so it can heal. Because the great thing about chiropractic, which really drew me to it, is that I was never taught growing up, like, the body is meant to heal itself. We're all born with the innate ability to heal. That's how, if we cut our hand, it heals, right? Very often we don't have to get stitches. We have little cuts and things like that, and our body heals itself. It's amazing. So that was a really exciting thing for me. But, and to teach people that in order to heal, a few things need to happen. We need to take away any interference, and that's where I come in. There could be a lot of nerve interference at the spinal level and nerves and things like that. Take away any interference and also give the body what it needs. And that might mean rest, that might mean laying low, that might mean extra water, eating well, and having a great lifestyle. So those two combinations will set a foundation so the body can heal.
Well, it's like one of the things I notice about my studies and just trying to understand the spine, I mean, just beginning to even have a concept of it, it's so complicated. It's an amazing piece of architecture. It's so strong. I mean, it's bone, and in the center of that is your whole nervous system that runs everything.
Right.
And so, you think of it like, I just got a sore back.
Yes.
I mean, when you really start thinking about it, it affects everything. It can affect your hand, your fingers numb.
Yes.
And that's happened to me. I've done, things I shouldn't have done.
Yes.
Gone beyond the point my body should have gone, and end up with funny things. So when someone comes into your office, what can they expect? Like, for example, if you have a sore back or someplace in there, are you going to just adjust them, or what are you going to do to them?
No, we don't just adjust them. Again, like I mentioned earlier, we definitely want to do a thorough consultation, history, examination, any x-rays if necessary. Once we have all that information, we have a bigger understanding of what's going on. Then, and if I decide to take the patient as a chiropractic patient, because sometimes people need to take care of some other health issues first, depending on what's going on. But if I decide to take care of the patient, then we can go ahead and adjust. So I practice this technique. I'm the only doctor in the Merrimack Valley that practices it. It's called Corin-specific technique, and it's a very light force technique that there's no cracking and popping and very forceful movements. I use this tool here. It's called an arthrostem, and I plug it in.
It looks like a nail gun.
Yeah, it does. That's right. It does look like that. Looks like a nail gun. So I use the arthrostem. And I can just tap, it taps 12 beats per second, and I can turn it up, I can turn it down, depending, obviously it's lighter near the skull, heavier near the low back, and believe it or not, just tapping this in the areas that the patient is out of alignment, this actually adjusts the spine. I also look more than the spine. I look to the ribs and the sternum and the cranial bones and even the extremities. I can also put different attachments on it, which is great. So like this is a great attachment for the ribs. This here is a great attachment for the lower portion of the sacrum. So that's always helpful. And different than other chiropractors as well, I will check a patient in different postures because most chiropractors adjust you lying down. But what are we doing during the day? We're sitting,
Standing up,
we're
right.
standing,
Yeah,
we're doing.
sitting.
So I always check the patient standing. If they need an adjustment, they get an adjustment. If they don't need an adjustment, we move on. Because you could be out of alignment in different postures. I'll adjust a patient sitting, and then if need be, lying down, and just different positions, sometimes side lying and things like that. So that's really helpful as well, is that I can adjust a patient in different positions. And it helps with injuries. Like if somebody gets into a car accident, they were injured while they were seated. So it's very helpful to get adjusted while you're seated because you want to go back to the mechanism of injury. And so it's really helpful for that. Or if somebody, they went down to pick something up really heavy and ouch, well then I can put them in that position and adjust them either going down, coming up. It's really effective in that way, kind of getting to the source.
It seems to make more sense. I mean, because I know, in fact, a physical therapist said to me, he said, when you train, a lot of people have this strange weightlifting type style. and then you go out in the real world and you do everything different.
Yes.
And so now you get these two sets of muscles working
Yes.
against you. And you just,
Yes.
if you don't think about that, what you're doing and how you're training,
Yes.
then I guess that's why a lot of people become what they call muscle bound.
Yes.
Like they're
Yes.
very strong and they've reached their goals, but they can't move.
Right.
So, you know, like a lot of times I think headache, because when you take the spine, I mean, that's it, right? Everything's going right in here. And those have always been mine, like if I've done something driving. So right in here, I'd feel that, you know, kind of like really tension headache. And really debilitating stuff.
It can be.
Yeah. But then, you know, people have told me, well, that's probably because you're sitting for a long time, you're driving, so there's some little thing in your spine. So that's what you'd do. You'd go in and kind of try to find out what that was.
Yes, that's a great, great way to put it as well, is that this is another interesting thing about what I do. Very often, somebody might come in with a headache, like you're describing from driving or after driving, and yet, when I'm assessing them and adjusting them, a lot of their primary misalignments or subluxation, we call them, it may be in their low back or their sacrum. And it's because everything is connected. So the great thing about chiropractic is that we look at the whole spine. We don't just, if somebody has neck pain, we're not only looking at the neck, because very often you could be out of alignment at the foundation of the spine, the sacrum, and that it could affect, you know, how the rest of the spine is behaving. So you can have primary subluxations and then things, you know, the rest of the spine adapts and things like that too. So, so it's really very rewarding, because it even surprises me sometimes. You know, I had a woman that she came in and she had a lot of rib pain and she couldn't turn her head that well without pain, and yet most of her subluxations or some misalignments were in her low back, and yet she got well. So it's really, everything is certainly connected, looking holistically
and I
at the
think,
body. So,
you know,
yeah.
we as kind of lay people or users of the body seem to like, if, you know, if I have a pain in my shoulder, that's it, you know.
Right, that's
take
where the
care of
problem
that,
is.
please. Yeah,
Yes.
the thing, it's right there, get rid of it.
Yes.
But, you know, as I look into the spine, I mean, I could see why you'd want to be a chiropractor, because you guys must spend a lot of time in the spine.
Yes.
In your education.
Yes.
It's fascinating.
It is.
What's going on in there.
It is.
When I think of all even the diseases that are related to the peripheral nervous system, you know, and our last show we had somebody here who was about Alzheimer's, you know. And I really wonder, like, we really have to start looking not at where these things come from after they're here, but I almost think that posture, especially because so much is being sent in and out of that area. I mean, you know, how many nerves are there in that you have to be aware of?
Yes.
I mean, there's
countless.
Hundreds? I mean, thousands?
Yeah, thousands. And that's exactly right.
Blood flow, you know.
Yeah, and so, I mean, you have the spine. So, like you said, the central nervous system is the spinal cord, which is the spine protects. The spinal cord is here, so that's the central nervous system. The brain and the spinal cord is the central nervous system, and that controls and coordinates everything in the body. So then off of that, we have these spinal nerves that come out, and again, those go to the body, down our arms, down our legs, all our organs.
And would that be considered the peripheral nervous system?
Yes.
Okay.
Yep. Yep.
'Cause I'm
Very
actually getting,
good.
well,
Yes.
I'm learning this.
Oh, yeah.
When you were coming on, I had to go look some stuff up, and now I'm kind of like, I get
Yes.
into things, and now
Yeah.
I'm in
So
trouble.
everything is certainly connected, and so, like you said, if there's a problem in the spine, very often it's more than just a backache, you know, because this controls and coordinates everything. So very often I'll have people come in with low back pain, but then under care they may say, geez, I sleep better. You know, I feel calmer, or my acid reflux is getting better. It's because we're relieving all the nerve interference wherever the misalignments are, and then their body can function better. So our goal is chiropractic. Yes, we want to help people get out of pain, but really we want your body to function as optimal as it can. So if you have a normal functioning nervous system without interference, your body can be as healthy as it can be from that point of view. So it really is that important. I had a friend of mine asked me, it was unfortunate, that she, her son was born with half a vertebra, so it's just a very rare thing. He was born with half a vertebra down here, so his spine curved because it adapted. It was a really bad scoliosis. And her question was, well, do we really need to get it fixed, or isn't it just like crooked teeth? And I said, it's not like crooked teeth.
Oh, yeah.
It's so much different because this is right near his central nervous system. So it's really important to address that. So it's different than just, other things that are a little crooked.
Yeah, you
as
can get
well.
away
So-
with certain things, yeah.
Yes.
Just let them go, But,
Yes. So.
But I guess it's like everything. We pay for whatever we don't take care of, right?
Right.
So now when you take the spine, like the places I did it, when I was younger, I was in contracting.
Okay.
And we always did things the most efficient way,
Okay.
not the smartest way.
Okay.
So, always picking things
Fastest
up.
way.
And, I have a number of things that come with that. But I know that if I don't exercise regularly, my lower back will go crazy. And as long as I keep exercising and keep at least somewhat, limber. What about yoga? What do you think of yoga as an
Yes,
option?
I think yoga can be great. I always caution people if they've never done it before, no matter what age, to really go slow. I think it's important to start, if you're a beginner yoga person, to start off with an instructor so they can kind of monitor your positions and things like that. Because again, if you're not used to it and it's out of your realm of understanding, you certainly could hurt yourself. But I think yoga is great.
Yeah,
yoga's
and I know I've been in yoga classes where people are asking me to do things that are a little too extreme, which I wouldn't do.
Right.
Because, there's no way I'm going to hurt myself for them. But I think you're right. I mean, anybody who could start out at a younger age and keep with yoga would probably have a reasonably flexible spine.
Yes,
You
yes. And I just want to point out as well, keeping your muscles strong is very important to your health. However, it doesn't guarantee that your spine will never go out of alignment. It could cut down on injuries, and it certainly could cut down on weaknesses, to go out of alignment. But there's a lot of confusion, like, oh, I don't need a chiropractor, I go to the gym every day. And while it keeps you stronger, just keeping your muscles strong around your spine. Now, if your spine is out of alignment, right? And you don't know it, because the thing with pain is that it's telling us there's a problem, but your spine could be out of alignment and you don't have any pain at all. It's very silent.
That's scary, yeah.
Yeah, you could go years and you
Yeah.
could be out of alignment, maybe right up in here, and now you're going to the gym and you're lifting weights or you're doing all the things you do, and you're strengthening the muscles around that misalignment, so you're just reinforcing the
Reinforcing that,
misalignment.
whatever.
So while exercise is very important, especially quality of life as we all get older, it doesn't take the place of making sure the nervous system is clear, and that's a big part of my education as well.
So kind of as I talk to you, am I getting the sense that if you were running the world, would you have people come in just like for regular checkups on
Yes.
their spine?
Yeah.
I mean, that seems almost a no-brainer when you talk it about, it's better to do it before than after?
Yes, so I adjust babies. I've adjusted anywhere from a newborn all the way up to somebody 95 years old. So all ranges, especially what I do is very gentle, so it's totally safe for any age. So yes, and it's interesting, I have this family that comes in and she brings her children. So her children when she was 3 days old, and then her daughter's 4 now. And she'll explain, so this is from her perspective. She tells her friends, I'm going to bring my kids to the chiropractor. Why could they possibly need a chiropractor? And she said, because I'm not bringing them for pain, I'm bringing them to keep their nervous system healthy. So they're just healthier kids.
Wow, yeah.
Yeah, so that would be my dream practice, is just having people come in and, hey, I just want to be healthy and keep myself. And if a child is taught to take care of themselves and they can be more in tune with their body, geez, maybe I'm out of alignment, maybe I should get tuned up. That's always a great way to learn too, as opposed to when we're older and we kind of taught to ignore a lot of our pain, tough it up and you'll be fine and all this other stuff. So I think children just grow up healthier. And children that are adjusted, statistically, they're usually just healthier. They have less ear infections and less infections in general, and they're just healthier.
Yeah, no,
Grow up to healthy adults.
as you talk, it's that, especially with people as they start getting into their senior years, it almost seems it's kind of a preventative medicine.
Right. Yes.
That if they came in and just we had someone check their spine out, at least, because I can think of so many things the more I learn about the spine, especially that peripheral central nervous system, everything goes through it.
Yes. Yep.
I mean, if you don't have your spine, you're not doing well. You're not going to have a very good
And
day.
guess what? Even the technology is amazing out there, but you cannot get a spine replacement. So you can
Yeah,
get
right.
dentures if your teeth go bad or they're crooked and things like that. You can get dentures, but you
Yeah.
can't do that with the spine. So you really want to do your best to take care of it because that's the only one you have. So
Yeah,
it's that
that's a
important.
really good point. And,
Yeah.
and I imagine, like, if that was part of a practice, now, is probably not a fair question to ask you, but from an expense factor, is chiropractic, is it an expensive process?
Well, I don't think so, but I think it's all about what you value, right? I mean, if people value something, they're going to pay for it. So
Right.
I think, especially from a prevention point of view, I think very often people are saving thousands of dollars in pain, lost time off work, colds and things that cause you to be unhealthy. So if you're keeping up with it and you're regular with your adjustments, I feel that it's hugely cost effective.
And is it generally covered by insurance?
Yeah, most insurance cover it these days. So although insurance in general is changing, so there's
Yeah, I
not
know, you gotta
high
really-
deductibles and high co-payments and
Yeah.
things like that. But yeah, insurance cover it. And I believe I make my fees affordable. So whether you have insurance or not, I believe I make it very affordable for people to come in. They don't have to go
Yeah,
out and
no,
take out a loan to
it
come
seems
into
like
my
a,
office. So.
Because that's in the back of my head, you think of all these things you do to try to do your annual maintenance things, your body, and try to have all these things checked up with physicals. And I guess it makes sense to have a spine specialist checking you out once in a while.
Yes,
Even if you did it
absolutely.
twice a year, right?
Yeah, anything is better. Yeah, for sure,
Yeah.
anything is better. And very often when you're, if you're keeping small problems small, so you're getting checked out and you had a misalignment subluxation pattern and it was corrected, then at least it's not staying that way for years and years to come. You're preventing, and you're probably down the road preventing wear and tear. Because very often when the reason our body and our spines degenerate is usually it's a trauma, either a car accident or a sporting trauma or overuse, kind of a micro trauma, doing the same thing over and over and over. And very often our spines just get misaligned and they get locked up, so there's no motion in there.
Oh.
And motion
Ow.
is life. So if it stays that way over years, that's how the joint functions properly, is that motion. So that's what's going to cause wear and tear and breakdown. So very often, getting your spine checked can prevent a lot of
It
that.
seems
as
to
well.
me that, like, most of the people that I know that had spine problems from construction or compression, it was that little section inside there, that little, what is that called? What is that, those little rubbery
Yep, the
things?
disc. Yeah.
Those
right
things
here.
there get, and I mean, I've seen things where people said that they're just going to get squashed out. I mean, does that make sense? Almost to the point where that's scary.
Well, you hear all sorts of
Yeah.
things. I'll hear a lot of different adjectives, like my disc is out. Not really sure what that means.
Slip
but-
disc, right, that's what, slip disc was a
Yeah,
big
I
thing,
mean, the disc in between the vertebra is pretty strong. It's a cartilage, but it's a very strong cartilage. It's not, it's not this.
It's not crispy, right?
It's not crispy. There's a give to it that makes it the shock absorber. But very often over time, sometimes, and they don't just slip out of there. They're a lot more stable than that. Sometimes they can bulge, like you can see this red thing. So sometimes the disc can bulge out.
Okay.
And then that can press on nerves. Sometimes the disc can almost explode from the inside out. That's when it herniates. So it's kind of from an inside injury, it kind of comes out. But very often they don't just slip out of there as well. And then another thing can happen with the disc, wear and tear. They'll slowly just start to get thinner and thinner and thinner. So that's the arthritis and wear and tear and degeneration. So lots of things can happen. They can, and very often, even if you had an injury, a compression injury, the disc isn't going to all of a sudden
Just disappear.
disappear. No,
No
that's
place for
going
it
to
to
take
go.
time over time. But that injury can certainly.
So, and you mentioned something about arthritis,
Mm-hmm.
and where does that generally show up? Can that show any place in the spine from your perspective? Or is
Yes, it can show any place anywhere there's a joint.
What does
You
it
can have
look like or
arthritis.
feel
You
like?
can have it in your fingers. Well, it can be anywhere from you have no pain at all, because some people have arthritis and they don't have any symptoms, believe it or not. Just a lot of achiness. The typical is it feels worse in the morning, and then when your blood flow gets better, you know, the blood flow and things like that, you can feel better. Stiffness. A lot of stiffness because you're not having the motion. Common areas of the spine is the low back because it takes a lot of the brunt. And then even in the neck, I see a lot in the neck, kind of in the middle of the neck, you know, that's taking your brunt.
Okay.
But very often, I've seen it everywhere. You know, I'll see it in like right here, but usually it's because somebody had an injury or they fell a long time ago.
Yeah.
So that's where it adapted and that's where it started. So they're very, yeah, it can be, but you could have it in your fingers, you can have it in your hips, you can have degeneration in any joint in the body. Yep.
I mean, there was one good thing I think that should wake us up, but I think last week there was some Mexican wrestler that was kicked in the back. Did you see that?
I did not.
He actually died from it, but he was kicked in the center of the back, they said, and he kind of just went out.
I did not. That's
Yeah.
awful.
Yeah, I mean, it was bad, but I mean, you don't think about how important your spine is. You know, you think
Yes.
it's all muscles, and you know, especially like I think of professional athletes. You know,
Yes.
basketball players, and you know, their spines are much longer.
Yes.
And then the fact of everything that's going into athletes and heavy people that just, I guess, work heavy. It just seems a no-brainer now that if so maybe I guess you guys all promote that anyhow, that people come in regularly, right?
Oh, yeah, of course.
Oh, good. Because I always think like something like chiropractor would only be, they kind of laugh at you if you come in and say, well, I have no pain, I'm just in here for an adjustment to feel good.
Right.
But that's what you guys look for then, as you
Yeah,
said.
we would love for everybody to do that with us. But, you know, the more we educate people and people see the importance of it, very often my patients will learn on their own, where I'll get them through an intensive phase of therapy. They came in with some sort of pain. I said, okay, now we're going to, we stabilize them. Now we suggest maintenance. Maybe once, and that maintenance is different. I mean, it could be anywhere from once every other week to once a month to once every 6 months, or I mean, once every 6 weeks or so. It's different for everybody depending on the condition of their spine. So I had this gentleman come in. He said, oh no, I don't need to do that. And then maybe a year later, he came in with a similar complaint and, wear and tear, whatever he's doing during his day. And then he kind of had to, in a sense, start over doing intensive care. And so finally he said, you know what? I think I'm just going to maintain my spine because it's just easier. So there you go. He valued it. Just going to maintain my spine and come in for maintenance, even if he's been doing that for a couple of years, and he's been doing great. So that was just important to him. But he had to learn that on his own.
I know. I mean, as consumers of medical services, we're not really very aware, I don't think, as a consumer.
Right.
The things where we should put our resources and where we shouldn't.
Yes. And also chiropractic we'd love to deal more with prevention and lifestyle. So what is that? It's taking care of your body before it breaks down and gets sick. That's really the key in health. It's not waiting. The definition of medicine is the treatment of illness or disease. So it's waiting until you have a problem and then doing something about it. Whereas chiropractic, we'd like to kind of catch you before all that as well, because it's just easier. And yeah, I mean, that's really the...
Well, I think it's a good point, because when we get into talk about pain, and especially we get older, I think a lot of people, I find them relying on pain medication, like over the counter.
Right.
And from my understanding, for what I've learned anyhow, that it's not the greatest thing for your liver and kidneys because of the concentration of it. So people, rather than, it could be interesting, people rather than go and get an adjustment would prefer to spend $9.98 for a bottle of something and take them and then relieve the pain for a while anyhow. So I think from an elderly point of view, I notice a lot of people are doing that now. They have pain and they go and check, so they check on the, what they're going to take. So I guess what we're saying is, for anybody who's elderly, that they will just do that. Okay, I guess we're running out of time here, and I could go on. That's why
exactly.
I've
I guess
got
that went
ideas.
by fast.
I could go. I know, another 45 minutes and ask you questions. But anyhow, I think it was great. I hope everybody at home got something out of this. And what we will do is maybe sometime in the future we'll ask Beth back and we'll hit this from a different perspective maybe, the idea of pain and spine, and actually see her in work doing some things.
Sure.
That'd be fun, huh? Go
Yeah.
down there and actually
of
see
fun.
some
Yeah.
things, okay. Well, all right, well, Beth, thanks a lot for coming in.
Thank
I
you for
really
having me.
appreciate it, and I thank you for watching, and we'll be back next time, and we're going to talk about the economics of aging, how it's getting very expensive to get older, and we're lasting longer than we did before. So there's some interesting concepts of how we can afford that. So I thank you very much. I'm Richard Mullen, your host. Goodbye.